I am your host, Gary Baumgarten. I welcome you to the show, and I encourage you to go early and often, just like voting in Chicago, to reportergary.com. Reportergary.com. That is the news site for the Paltalk News Network, the website for the Paltalk News Network, where you will see stories that you may or may not see, hear, or read in the mainstream media. Go ahead, Sylvia.
Hi, Gary, and hi, Kim.
Hi, Sylvia.
And good afternoon to both of you. Kim, I really feel for you and your sister. I'm bipolar. It took them 50 years to diagnose me. I always knew I was slightly off, but I didn't, you don't diagnose yourself, and yes, I did self-medicate. I also want to make a point that Medicare only gives you 20 days of mental health benefits. 20 days of mental health benefits. That's outrageous. Even my private policy before I turned 65 gave me 30 days. I also want to make another point. I walked into my psychiatrist's office with my Medicare card for the first time, and her secretary said, "Oh, we don't take Medicare." And I went, "What?" I was hysterical. And my psychiatrist heard me and came running out of the office and said, no, she knew what we were talking about. She said, no, that doesn't apply to you. I don't turn away patients that I've had for a long time.
Yeah, but that is a problem, Sylvia, and I have to cut you off, but that is a problem, and that speaks to the overall issue of medical care, not just mental health care in the United States, given the fact that states are running out of funds, and they can't fund this stuff. In Arizona, the instant state that we're discussing, as Victoria Jones reported yesterday, there are all kinds of allegations that people have been refused life-saving organ transplants and have died as a result. Let's go to Cassandra in the United Kingdom. Cassandra, welcome to News Talk Online on the Paltalk News Network.
Thank you very much, Gary, and hello, Kim. Very, very sad what the story that you were telling us. I believe that in 2008, the Treatment Advocacy Centre did a survey on mental health and mental health provision, and Arizona came second to bottom in that particular survey, with Nevada at the bottom, incidentally, saying that they didn't have enough facilities or treatments available to people with mental illness. And I was wondering, and according to the survey also, no state, not one state, has sufficient beds or treatment facilities that are available. Do you feel that under the new healthcare bill that is going into sort of through the House at the moment, or through your administration, that the mental health issues need to be the thing that is addressed? I know that the big mental health facilities were awful. They were closed down, but when they were closed down, it left a tremendous void. Is there a way of mitigating this and making provision in America throughout the states?
Cassandra, I actually think that the bill as it is horrible for mental illness. There's nothing in there. There's a little bit of parity, which would give you the same coverage on your insurance policy. Like if you can go to a doctor as many times as you want, you can now go to your doctor, your psychiatrist, as many times as you can go to your doctor. However, you'd have to work for a company that hired 51 people or more in order to even receive that. And most people these days are either independent or have small companies. So there's not enough. I don't really mean it's bad. I agree with everything you said. I think that I didn't agree with closing hospitals. I think we need them. I don't think they were perfect. But we have nothing now. The units in our state. There's only a few places you can really go. So it's
and you know, if you want to compare that a step further with private insurance, most private insurance medical care, the ones that do include mental health, it's extremely minimal. I know mental health professionals who say they have to turn people away because the insurance will not include them in their plan, or if they will, they won't compensate them sufficiently for them to spend the kind of time that they need one-on-one with each patient in order to treat them properly. You know, you can't run people through 5 minutes at a time when it comes to mental health care. And so they are very concerned about the fact that you know, that there are a lot of people out there that are going untreated. Let's go to Jim then in Michigan. Jim, welcome to News Talk Online on the Paltalk News Network.
Well, thank you very much, Gary. Fortunately, where I have insurance, if you need mental consultation or psychiatric help or something, it's covered. I mean, but don't forget that hospital had 8,000 employees, and as one of them, if I wasn't thinking straight, it could happen that I could get treatments. Now, I'd have to pay for it out of my copay. It wouldn't be given free, but it is available. And the most interesting thing I heard about therapy, that those who have a tendency to be gay, which of course I am not, but the therapy, they can cure it if the patient's willing.
Cure gayness? Is that what you just suggested?
That there is psychiatric approach proven that the patient has to be willing to accept it to cure gayety. Yes, that's what I said.
Well, I didn't know that being gay was a disease, for starters, and secondly, I don't think you can pray or psychologically or psychiatrically treat somebody for their gayness. You might help them with the problems that they are faced dealing and accepting themselves for who they are, but I don't think you can treat somebody for being gay.